carefully chosen, once in a lifetime, intense post-op and care. Vinegar is an acid. Apple juice is essentially like a type of acid. It's all about, again, choosing what matters is the right percentage, the right type, each different kind, and we tend to use fruit acids, tend to be the most commonly used ones.
Well, it's interesting you comment on it because I think it goes against my own mindset. I'm one of these people, like, psychologically, like, I like feeling that burn. And people are like, that's just sick. I'm like, no, there's people like us out there. Like, we feel like if you're not appreciating.
So I tell the patients to expect it to be a pretty easy experience.
Welcome to Derm-It Trotter. Don't swear about skincare, where host Dr. Shannon C. Trotter, a board-certified dermatologist, sits down with fellow dermatologists and skincare experts to separate fact from fiction and simplify skincare. Let's get started.
Welcome to the Derm-It Trotter Don't Swear About Skincare podcast. I have a special guest on here today, Dr. Linder. She's a board-certified dermatologist and fellowship-trained skin cancer surgeon using Mohs micrographic technique. Prior to founding Linder Health, Dr. Linder founded and served as Chief Scientific Officer for PCA Skin. She has been a medical advisor and trainer for multiple fillers, biostimulators, and neurotoxins. She has also published and lectured on a broad spectrum of topics, including aesthetics, dermatology, product development, and of course, skincare. And we brought her on the podcast today to talk more about chemical peels. So welcome to the podcast. It's great to have you with us.
Thanks for having me.
Of course. Chemical peels are things, patients always want to get more information about. They're talking, to their friends about them. They read about them in a magazine or maybe even gone in to talk to their dermatologist. Can you kind of just explain, what exactly is a chemical peel?
So in the simplest terms, a chemical peel is a way of harnessing some of your body's natural ability to trigger cell turnover. When we're babies, our cells turn over like every 2 weeks. And then when you go into your 30s, it's about once a month. And as you get a little bit older, like myself, in that plus 50 range, you're down to even as long as every 90 days, sometimes even as many as long as 120 days. So as that cell turnover process slows down, that means the new baby cells aren't rising from the bottom up to the top. So one of the things that a peel can do, and this is what we kind of thought it primarily did, was actually get those new cells to go from the bottom to the top. And when you do that, you're bringing new young cells to the surface at the same time as doing cell turnover in terms of pigmentation, bringing collagen in, elastin, all these different things. But you're also harnessing the wound healing process. And we now understand you're doing more things as well. And that's kind of where the science has gotten more interesting in the last couple of years.
Very cool, but also depressing. The way you mentioned how this goes down over time, and that cell turnover for us is not something that we maintain like we would like to. But good news that we have chemical peels to maybe help with that, like you said. When you think about chemical peels, you mentioned this a little bit, and kind of like who would be maybe a good candidate, or what type of skin needs are we addressing with peels? So if somebody comes into your office and says, "Hey, I need a chemical peel," when you're assessing them, what types of things are you thinking a peel may help you with?
So it really is everything from acne is one of my actually favorite things to do it for. So I love having teenagers, young adults come in, even those patients sometimes as often as every 2 weeks, because we're really trying to get the cell turnover, open up the pores, get the skin to heal. But the most common situation is just overall skin health, anything that is preventative, and that whole anti-aging category. And then the thing that really, I think, is the real absolute sweet spot of chemical peels is anything related to pigmentation, whether it is pigmentation from sun damage. So unfortunately, like too much sun, that's one of the things that usually is the first sign of aging is pigmentation, whether or not it's little brown spots, or for something like melasma, which is that we used to say called the mask of pregnancy, but really is, it can actually even happen in men, but it tends to have a hormonal component to it where people end up with kind of brown patches. You can almost take an outline of them on their cheeks or foreheads. Actually can be anywhere on the body, but peels really are the one thing that does better than even peels. Even better than laser when it comes to lifting hyperpigmentation.
And that's something a lot of people come in and complain about, the hyperpigmentation, like you mentioned, sun damage, or, maybe genetic factors play a role for that too. And very frustrated too, especially the lack of response, with using a topical cream that they may have exhausted for months and not seeing much of any result. But when you think then of somebody coming in for a peel, are there, certain patients that you would look at, or skin types that it's, more difficult to do a peel on, or you just need to know the right way to peel their skin? Because everyone gets a little cautious, I've had somebody had a peel. They turned out they got more dark marks, or they got too light of marks on their skin. How do you handle that for a patient that's coming in and asking about a peel in their skin type?
Well, it really does come down to, of course, educating yourself as a physician or caregiver and the patient themselves, because peels are as broad as saying laser, right? You can have something that is designed to be basically peel all the skin off, laser, almost like a full ablative laser resurfacing, where it is taking deep etched in lines out. Now, those patients, you want what we call Fitzpatrick 1 to 3, which are paler patients like you and me who've had a lot of sun damage, a lot of etched in lines, carefully chosen, once in a lifetime, intense post-op and care. That's one far spectrum. The other spectrum is literally can be done in everybody, whether or not you are type 1 and have red hair and freckles, or you have deep, dark, ebony, melanated skin, and can be used on anybody in that spectrum. What matters is the right peel is chosen for the right patient. Just like we do anything in medicine, it's understanding that choice that makes all the difference.
And I think it's good for patients to understand that, because there are probably people sitting out there like, well, I know my friend, she got this peel and it worked fantastic for her. I went and did it and it didn't really, accomplish anything I was looking for. So I really like how you highlight it's really individual to the patient based on their needs, potentially also skin type and what might be appropriate. Because I think people kind of just assume a chemical peel is a chemical peel, right? And we know as dermatologists, you can really cater to the patient and what you're trying to accomplish. So now that we're kind of diving into that a little bit more on the chemical peel level, do you mind going over, and I know there's a lot to this question, just some
Yeah.
of the basics of the different types of chemical peels that are out there?
I would be more than happy to. So, one of the peels I'd mentioned was the deeper peels. Those are the things that tend to have like phenol or TCA in them. And basically, a chemical peel is what is the one consistency across all the different kinds are acids. And acid can sound scary. It's a word that can sound a little bit daunting, but don't forget that, vinegar is an acid. Apple juice is essentially like a type of acid. It's all about, again, choosing what matters is the right percentage, the right type, each different kind. And we tend to use fruit acids, tend to be the most commonly used ones. Different things have different capabilities. I like to say it's much like cooking. You can take the same ingredients, eggs, butter, salt, flour, sugar, and you can make a million different types of baked goods. It's all about how it's put together, how you actually cook with it, right, to make different delicious things. And peels are like that too, and that's sort of where is my personal sweet spot, is thinking about the product development side. How do I take different ingredients? And I personally love to do blends of ingredients. Those are actually the type of peels I recommend. The things I'm going to be talking that I think are the most useful in general are what we used to define as being superficial chemical peels. I don't want people to think that means it's not doing much. Matter of fact, I think they do a lot. We tend to do those more in series, even though you can see a great result in just one treatment rather than but series are often what is the way you get your sort of best case scenario. Versus if you're doing like a medium or a deep chemical peel, that tends to be a one-time, maybe even just one time in your lifetime kind of thing. And that's when you're really taking out the top layers of the skin. So let's just decide we're going to talk about more of that kind of what we refer to as superficial chemical peels, because those are the things that in general are best for everybody and can treat the widest swath of whether or not it's anti-aging or different disease processes. So in general, most things tend to be fruit acids, and those fruit acids, some of the ones that sort of became really known during the 90s was glycolic acid. You might have heard about that. Sometimes you'll see it in washes even. And the higher the percentage, often with those, the lower the pH is. And the lower the pH, often means it goes deeper and might sting more. So with those situations, the glycolic acid molecule is a sugar molecule, and it's really small, but that means it goes quite deep quickly. It's the reason why glycolic acid tends to tingle and burn and kind of feel funny. Now, during the 90s, this was the first one we started using. But now we understand that glycolic acid can actually be quite dehydrating. So I like to say that if there's one thing people take away from my entire talk, please remember glycolic acid should only be used for oily or acne prone patients, whether or not it is in a cleanser or if it's in a peel. Just remember that glycolic acid, the science from the 90s, we've been able to improve it. Please just save it for that situation. Now, on the opposite end of the spectrum is something called lactic acid, and lactic acid is a molecule that is what we call the natural moisturizing factor of the cell, which is almost, you can think about it like the sponge inside the cell that holds onto water. So that is an ingredient where you actually, by choosing that type of acid, is actually going to hydrate the skin from the inside. So the opposite of glycolic acid. So one is dehydrating and drying the skin and works on oily prone skin, and lactic acid is hydrating. So I love to use lactic acid anytime I'm dealing with somebody with more mature skin, or basically most of us actually want to have our skin be in a healthy place, and lactic acid is a great reason for doing that. Then the next thing you think about in terms of choosing ingredients is what else am I wanting to do? And if I'm wanting to think about acne, or I might want to be thinking about what qualities do I want a peel to have. We often have found now that patients don't want the downtime of the skin sheeting off and being like a snake. So if you can get the skin to come off in tiny little bits, same amount comes off, but it can come off like dandruff instead, then most people like the experience better. So to do that, you actually choose an acid that has what's called an aromatic ring, and it just sort of chops up the desmosomes in a different way, those little things that glue the skin cells to each other. And to do that, you do one of two things. You either do salicylic acid, which is one of the main ingredients in aspirin, so it's also non-inflammatory, or you choose an ingredient like mandelic acid, which also has the same aromatic ring. Also works great on acne because it has a lipophilic quality, so it's drawn to oil, and so it can get inside, clog pores. And so for everybody, salicylic acid and mandelic acid will open up the pores, make the skin look more glowy, be anti-inflammatory, and as a just lifestyle thing, it chops up the little peel flakes in tiny little bits. So those are, by thinking about all these different ingredients, you can combine them together so that you can have a less acidic, so essentially a higher pH, closer to skin's natural pH, capture what the ingredients are doing without being inflammatory, and get the cell turnover, get the working on the acne component, the lipophilic component, as well as there's all these kind of sexy new things we can talk about down the line that are anti-aging in terms of senescent cells, and also going after mitochondrial health. There's just all these new things that peels can do. So that was a very long-winded answer. I think I might have even forgotten what the question was as I was talking. But to simply say that peels can kind of do everything for the skin, as long as you understand what the ingredients are and what the goal is. And then that's where the skincare specialist or the dermatologist decides, okay, this is the one that I think will work best for you based on what's going on for you. And that's where I love the consultation, right? I think that's what makes us special as doctors, is we look somebody in the eye, look at their skin and go, okay, today, this is the thing to do. And you know what? In 2 weeks when you come back, there might be even something different that I want to do. Also, don't underestimate what just one treatment can do. But if someone is really wanting to go after something like melasma, which is that more difficult to be treat pigment, often then we're thinking about more of a series.
So kind of jumping off of what you said throughout there. So it sounds like it's possible maybe to have your cake and eat it too, from the standpoint you don't necessarily need a ton of irritation to get results from peels. Is that right?
That is spot on. And that is really where the science has changed.
Mm-hmm.
So, I've been formulating with chemical peels for 25 years. I founded one company, sold that, let it go off and become its own. It's like having a kid go off to college. You realize they're going to make mistakes. They're going to have their own successes. But then during COVID, I got super obsessed with what was going on in the longevity space.
Mm-hmm.
And really understanding like, oh my gosh, if we can think about mitochondrial health, if we can control inflammation, if we can think about senescence, then we can do a better job. And by thinking about, okay, we don't have to do the most aggressive amount of wound healing to see a response. We can actually get better wound healing by controlling inflammation. So that led to thinking about, okay, let's get the pH closer to the natural skin pH, use lower percentages of ingredients, and then combine things together to get the best result. And by doing that, you can actually have non-inflammatory chemical peels, which is completely different way of thinking about it in the last, let's say, 5 years compared to what we were doing for the last 30 years. Because really the science hadn't really changed that much in the last 30 years. And before that, it had been 75 years or 100 years since changes had happened. And cool thing is peels have really been around since at least Cleopatra's time. She kept a herd of donkeys because she was using lactic acid milk baths to keep her skin looking fresh. She'd take a bath every day in sour milk. So like the girl knew what was going on. Yeah.
There may be somebody out there that's going to try that now, just so you know.
You know what? If they're up for keeping a herd of donkeys, go for it.
Have at it, right? Well, it's interesting you comment on it because I think it goes against my own mindset. I'm one of these people like psychologically, like I like feeling that burn. And people are like, that's just sick. I'm like, no, there's people like us out there. Like we feel like if you're not appreciating that sensation or maybe seeing those big sheets come off at once, we're sitting there wondering, is this peel doing anything? And I think it's just important you highlight that because it's going against that mantra, I think, of how some of us were trained or just psychologically, I'm that person. It doesn't bother me. In fact, I think psychologically it convinces me something's happening. So I think there's going to be some people that will have to convince that you can have both, the best of both worlds. It's just like, I love cleansers that lather. If I don't appreciate a lather, it doesn't feel clean to me, where a gel cleanser for some people, they love that. They don't care if it lathers. So I think in dermatology for people going in to see their dermatologist, the fact they can get the best of both worlds is really going to be a game changer for patients in the concept of a chemical peel, because that scares a lot of people off. You've probably met some patients once, traditionally things we used to offer, and thinking they're going to go through that discomfort. They're like, peel, not for me. But this opens a whole new world for those patients for sure.
Yeah, it's like, it's like that. It's a whole new world, the whole like Disney song. It really is a game changer because I think you are probably almost normative, like in terms of, I think we've been telling patients for so long that if it's hurt, it's doing something. You got to feel the burn, right? Yeah. It's like exercise. But we also know, like with exercise, you do too much, you actually hurt yourself. And it's potentially the same thing, that actually by understanding the chemistry, and I think this has been the big thing, is like actually thinking about the chemistry rather than just thinking about, okay, what result am I trying to get to? It allows us to actually take advantage of science and do it better. And so we can do it. And I've always used this idea of when you're treating a patient, tell them on a scale of 0 to 10, 0 being nothing and 10 being super uncomfortable, where are they? And then as long as you could get to you'd say like, oh, as long as they're a 5 or lower, you could do another layer. And the nice thing about this is because, most of the time, the first time you treat somebody, they might be like a 1 or a 2. That's all they're feeling, versus like these peels I've been doing for my entire lifetime was like, oh, okay, there's a little fire to start. Like, just like hold on through the pain. You're using fans and everything else on them. And that's just not necessary anymore. And so you really do have to, and then convince somebody like, oh no, this actually feels great. And then I think all they have to do is see the results the first time and you have somebody bought in. And it has such advantages because it means that like an acne patient, let's be honest, teenagers, they are not coming back to see you again if it hurts. Like they are not going to do it. So now I can get these kids to come in regularly, and they are asking their mom to come back. But the other thing, by not having inflammation and not having it hurt, is with this new generation of chemical peels, and I like to call them basically the next generation, is that you can do them in concert with other things. So when I do a lot of fillers and neurotoxin and biostimulators. And of course, you're making tiny little holes. You know, if you were putting traditional peel in there, it would sting and burn and you would not tolerate it. Versus with these, I can do it the same day as the appointment, just moments later. I do it myself even because I can do it so quickly. And then their experience is the last thing I've done with them is beautiful hands on them. And they're walking out with a glowing, beautiful skin rather than being like, oh my gosh, this woman stuck needles in my face. It's worth it, but gosh, it hurt. Instead, it's like, oh no, I look fantastic. And I can do it in concert with, you know, IPL, you know, intense pulse light. I can do it with the non-ablative lasers or even microneedling, as long as it's just pinpoint, because it doesn't hurt and because it's non-inflammatory. So I can get more out of procedures that myself or my staff have been doing for a long time and can get an even better result. So it's added this flexibility that allows my patients to get to a endpoint faster. And it's also expanded the armamentarium of my staff so that they can accomplish more as well.
So if somebody comes in then and they're wondering, okay, I'm ready to appeal, do you warn them then that there will be some discomfort depending upon the type of peel, or is this variable based on pain response, or do you really reassure them that this could potentially be painless for you and still get the good result?
I tell most of my patients, because primarily the peels I'm doing in my office now are these peels that I've formulated, unless I'm specifically going after doing like a phenol-based peel or doing a deeper TCA peel which is a totally different thought process, right? So I tell my patients to expect limited discomfort. Like maybe it's like a little tingling, kind of almost like that little itching sensation more so than anything else. And I have a exceptionally low pain threshold. I mean, exceptionally low. Like Botox needles make me I have to really, I put numbing on myself for all Botox, just to give you an idea of how bad I am. And this does not bother me in the least, versus I used to really have to like fan and everything else when I was doing even superficial chemical peels before. So I tell the patients to expect it to be a pretty easy experience. And that just makes it, I think then they're just like, oh my gosh, all of a sudden it becomes more like the experience of getting a facial. It's actually something they look forward to and can relax. Because I do think one of the things that makes this great at what we do is that hands-on piece. The fact, because I do believe that hands-on, looking somebody in the eye, listening to them, communicating with them is a big piece of the healing component. And I think the more we can do to have it be a better experience with them, with a hands-on experience, it lets them feel better about themselves, increases that level of trust, gives them hope, that I then do think has a huge factor in the skin actually getting better and actually healing. And so I think it allows for more of that. And I think that's one of the things that is my favorite component of doing these peels.
Well, you can definitely, feel and see the passion that you have for chemical peels. And you kind of alluded to this earlier, but tell me a little bit more about your chemical peels you developed and what makes them unique.
So the number one factor, it's kind of one of those things where I was, during COVID, instead of baking bread, started playing with chemistry. And many of my old friends that were with my old company and some of my scientists and chemists and everything, this is what we do, is we're all geeks, right? That's the reason why we went into dermatology, et cetera, is that, PubMed is what we read for fun. And it came out that peels can have benefit on senescent cells, actually can be a senolytic that can actually help with mitochondrial support, as well as all the traditional things that we know about peels in terms of collagen, elastin, all these different things. So the number one thing that's different about the Linder Health peels, and my favorite one is called Hero, is that it's a non-inflammatory peel. That is the number one takeaway from this whole thing, is that it gives that flexibility to be able to do it in concert with other things, to be able to work on pigment, anti-aging, actually get the skin healthier overall, going after multiple factors of what we call the 12 hallmarks of aging. And then the other thing is, because of the fact that you don't have to prep for them and you don't have to limit patients from what they're doing, they can actually, with sunscreen on, go out into the environment, go to their kids' soccer game, basketball game. They can even be outside where it's hot. It used to be that with peels, we'd have to limit them to, the colder months because you didn't want people in the sun and you didn't want them to get hot. But with this peel, because it's non-inflammatory, you can actually do it year round. And what that means for myself and my staff means that we can actually assume that when somebody is coming in, that we can do a peel the same day. So that means consult and treatment automatically can happen without having to change somebody's routine. And it just makes that whole process simpler. So I think that's one of the biggest differences, is that I really wanted to think about, okay, what are the pain points for both the patient and the clinician? And it was kind of more for myself and my chemist that we've been working together since the early aughts is, we all want to keep challenging ourselves in the spaces we love. And so that's what it kind of came down to, is like, okay, can we make it non-inflammatory? Can we make it work better for longevity? How do we make it simpler? And then the other thing that makes me crazy is when something is expensive to the practice. Literally to the practice, these peels are not expensive, which means they don't have to be expensive to the patient as a result. It just makes the whole process better across the board, because all of us have the same goal, which is get patients healthier.
Mm-hmm. Wow. I mean, I think today's conversation is really going to open our listeners' eyes to the fact that a chemical peel might be something they can consider. For those scared about the pain factor, you've helped re-educate that's not necessarily the case, and the fact that, they're versatile, right? They can accomplish a lot of goals that sometimes I think we kind of go, oh, chemical peels, and they kind of get put further down this totem pole of how well they truly can work for things that we want to actually treat in the skin. But you really illustrate that they can be impactful. And like I mentioned before, you can have your cake and eat it too, get the results without the pain. So thank you so much, Jennifer, for coming on today.
My
This has
pleasure.
been a fantastic conversation. For our listeners, if they want to find you, do you mind sharing where they can locate you?
Sure. You can find me at Jennifer Linder, LINDER MD, or you can find myself and my company, and obviously I do lots of things with that at Linder Health. So,
well, thank you again for coming on.
Please DM me, ask questions.
Yes, such a great time. And I know there's going to be people out there looking to get a chemical peel now, and probably specifically asking for yours. So thanks again for kind of teaching us more about chemical peels, and stay tuned for the next episode of Derm-It Trotter, Don't Swear About Skincare.
Thanks for listening to Derm-It Trotter. For more about skincare, visit dermattrotter.com. Don't forget to subscribe, leave a review, and share this podcast with anyone who needs a little skincare sanity. Until next time, stay skin smart.